Okay, friends, now we start schizophrenia. Eugen Bleuler coined the term schizophrenia. And Eugen Bleuler, this person, told that I am telling you four A's. I am telling you four A's, and if you find these four A's, the diagnosis is schizophrenia. Frequently asked question about four A's of Eugen Bleuler. So first A is autistic thinking and behavior, or fantasy thinking and behavior. Patient is lost in his own world, and sometimes in question you will find autism. Although autism is a different diagnosis, but you can remember that autism as autistic thinking and behavior. In few question you may find this also. Ambivalence means unable to decide. Unable to decide means a patient of schizophrenia is standing outside the door. He is unable to decide, should I go inside or not go inside, should I go or not. For 1 hour he is standing outside. This is ambivalence of schizophrenia. Means small issues of daily life he would be ambivalent. Affect disturbance. In affect disturbance, we found that schizophrenic patient have flat affect or blunt affect. Although these are two different things, but yes, for question purpose you can remember these two as same. Suppose I'm a schizophrenic patient, somebody came to me and say, Dr. Saab, you have won lottery of 1 crore rupees. What would be my response? If I am a normal, if I am normal, I would say, oh, I won 1 crore rupees, leave it, chutti. But if I am having schizophrenia, I would say, okay, 1 crore rupees. No fluctuation in the affect, flat emotional state. Inappropriate affect, means affect not matching with the social situation. Suppose Deepika called me, I am a schizophrenic patient, called me for her marriage. I go to marriage party of Deepika and start crying. I start crying not because she is my girlfriend, but because, yes, I'm having schizophrenia. Yes, I am having schizophrenia and I start crying. You will say, sir is having inappropriate affect. Affect is not matching with the social situation. What is the social situation? It's a marriage party. Marriage party, everybody is supposed to be happy. But a schizophrenic patient would go and start crying. We will say inappropriate affect. If Karina called me for Tamu's birthday, yes, again I go and start crying, inappropriate affect. Suppose I go to funeral and start smiling and laughing, oh theek hai, chala gaya, gone. So that is inappropriate affect. So three important example on which questions are asked. Birthday party, you go start crying, inappropriate affect. Marriage party, you go start crying, inappropriate affect. Funeral, you go start laughing, inappropriate affect. Yes. Association loosening of association. I told you formal thought disorder, loosening of association. We have discussed in the previous chapter in detail. Formal thought disorder. So Bleuler's 4A include these four, and questions are asked. Now we say we can't make diagnosis on the basis of these 4A. Now we have diagnostic criteria, ICD-11, DSM-5. So now we are following ICD-11. Okay, point it out. So we will remember the points of ICD-11. Now we will consider about etiology and dopamine, and what are the symptoms produced by the change in the dopamine level. We found that at mesolimbic pathway, if dopamine is increased, then it produce positive symptoms. So mnemonic is positive, मतलब इंक्रीज ज्यादा होगा, पॉजिटिव मींस इंक्रीज ज्यादा है. मीजोलिम्बिक, लिम्बिक मींस लॉन्ग, लंबा. यस, तो लंबा मतलब ज्यादा डोपामीन, इंक्रीज डोपामीन, पॉजिटिव सिम्टम्स. ओके, why I am telling you like this? Because you will encounter positive symptom, negative symptom. Positive symptoms are due to increased dopamine, negative symptoms are due to decreased dopamine. Positive means extra, yes, extra dopamine, and pathway is mesolimbic pathway, limbic matlab lamba. Okay, what are positive symptoms? These are delusion and hallucination are called positive symptom. Questions are asked. Delusion, most common delusion is delusion of persecution. I have already discussed delusion of persecution. And most common hallucination are auditory hallucination, hallucination. And whenever you find visual hallucination, yes, you always suspect organicity. Yes, if you remember, I told you recently asked question that perseveration, suspect organicity. If you find visual hallucination, suspect organicity. Now, negative symptoms. I told you these are delusion and hallucination are positive symptoms due to increased dopamine. Negative symptoms are due to decreased dopamine at mesocortical pathway. Mesocortical pathway. कोर्टिकोल C4 कम, हिंदी में बोले तो कम, डिक्रीज डोपामीन. Negative symptom. What are negative symptom? A logia, decrease verbal communication. You know, we have good communication, verbal communication. We talk to each other. We do share different things. But schizophrenic patient would have less verbal communication. Anhedonia, lack of pleasure in previously pleasurable activity. Previously pleasurable activity. Previously, I used to enjoy playing cricket, but I don't enjoy. Previously, I used to talk to my girlfriend, but now I don't enjoy. Anhedonia. It may be girlfriend is old. काफी लंबा टाइम रिलेशन हो गया है, लॉन्ग रिलेशन. सो दिस मे बी द रीजन, बट in psychiatry we will say, yes, if you are not getting pleasure talking to your girlfriend, yes, we will consider it anhedonia. Previously you used to enjoy, but now, yes, now you will never forget the definition. Asociality, these patients don't interact socially. Yes, apathy, they are not concerned about their future or different things, lack of concern. Volition means motor activity. Yes, loss of drive for meaningful activities or motor activity. No motive in the life. No motive in the life. And I just told you decreased dopamine. Decreased dopamine at mesocortical pathway produce negative symptoms. So simply, yes, positive symptom means extra dopamine. Yes, mesolimbic lumbar. Negative symptoms, negative means decreased dopamine, mesocortical pathway, C4 come, C4 cortical. Motor symptoms. So we have discussed till now schizophrenia, two types of symptom, positive symptom and negative symptom. Third type of symptom which may be found in schizophrenia are motor symptoms or catatonic symptoms. New name is catatonia. Catatonia. New name, better to say. Now it is separate class. Rather than saying that it's a new name, now we made a separate diagnosis. Catatonia is a separate diagnosis. Separate diagnosis in DSM-5 or ICD-11. Okay. So what are the symptoms of catatonia? Or what are the catatonic symptoms or motor symptoms? First is excitement. Suppose you are sitting in emergency, a patient of catatonia came to the emergency, is very violent, he is having very high psychomotor activity, non goal directed. कोई गोल डायरेक्टेड नहीं होगी, नो डायरेक्शन, वेरी हाई साइकोमोटर एक्टिविटी, वेरी aggressive, very difficult to handle. Yes, this is excitement. If excitement is present, we say this is excitatory catatonia. Excitatory catatonia. Yes, few patients of catatonia are having excitatory symptoms. We found that few patients of catatonia entered the OPD and they are standing like this. No movement means akinesia. Not speaking at all. Mutism. No response. You will ask question, yes, he will not respond or she will not respond. Yes, hyporesponsiveness. To external or internal factor. External factor means if you ask question, they are not responding. Internal factor means they are feeling hungry, but they will not move to take the food. Means hyporesponsiveness to internal or external factor. This is a triad. This triad is called stupor. Stupor, yes, is a triad is akinesia, mutism. So you can say Catatonia may be excitatory catatonia or it may be stuporous catatonia. Okay, so two types of catatonia means patient of catatonia may have either excitatory symptoms or stuporous symptoms. Other symptoms of catatonia, yes, other symptoms of catatonia, one is echolalia. Echo of language. Lalia means language. Mimicking examiner's language. If I ask patient, what is your name? Patient would say, what is your name? If I ask, where do you live? Patient would say, where do you live? Means you have just played copycat with your girlfriend, boyfriend. The same thing he is doing, but he is not playing. This is a part of illness. Catatonia. Yes. So, echopraxia. Praxia means motor movement. Praxia means motor movement. Yes, mimicking examiner's movement. What happened once our HOD entered the ward and one patient of catatonia was there. At that time, we were not able to make the diagnosis of catatonia, but whatever HOD did like this and this. Yes, patient did the same thing. This. Our HOD got angry and said, current laga do isko. Put him on ECT, electroconvulsive therapy. So angry young man. No, old man. No. He is not angry young old man. He is a very nice psychiatry professor. Yes, he immediately recognized that it is echopraxia and echopraxia catatonia is there, and the treatment of choice of catatonia is electroconvulsive therapy. This is the important question. Okay, but before that, initial treatment which you have tried earlier, injection lorazepam. Okay, so if they ask medical treatment or initial treatment, the answer would be injection lorazepam. If they ask yes, treatment of choice, the answer would be electroconvulsive therapy. So I have discussed the treatment of catatonia over here just to correlate that echopraxia seen in catatonia, and yes, in this you will put current लगा दिया. Yes, the same movie you've seen, you remember. I know you are thinking about that. You put the current, electricity, straightening of hair. That is diagnostic. Means we don't give general anesthesia, we don't give muscle relaxant, directly put current, that is electroconvulsive therapy, diagnostic. But nowadays, according to Mental Health Care Act 2017, direct ECT is banned. So this, yes, direct ECT means you can't put current without giving general anesthesia. General anesthesia, muscle relaxant you give, and now it is called indirect ECT. Indirect ECT, in which we give general anesthesia and muscle relaxant. Yes, so this is modified ECT. Actually, the treatment we will say like this. Okay. Next symptom of catatonia is posturing. Two image-based question I have given. Same question, same image, little bit modification, answer may change, posturing, waxy flexibility, catalepsy, how you will remember. Suppose I take this girl. Suppose this girl is lying down in this uncomfortable position for long time, 1 hour, 2 hour. You entered the ward, you are the sister. What happened? Why she's like that? So the nurses said that Dr. Saab, she's maintaining this abnormal posture spontaneously. We have done nothing. Just means patient maintain abnormal posture spontaneously. Maintain abnormal posture spontaneously. That is called posturing. Waxy flexibility. Waxy flexibility, what is? Suppose this patient is lying comfortably. You entered the ward, she's not having this abnormal posture, but she was lying comfortably. Now you start doing examination, neurological examination. Yes, if I move my hand, active movement. If you hold my hand and move, this is passive movement. If you are doing passive movement, and you feel no resistance and you leave my hand in abnormal posture and I maintain this abnormal posture for long hours, this is catalepsy, means maintenance of abnormal posture after passive movement and no resistance and no resistance and no resistance during those movement during examination. Yes, this is catalepsy. But if you are doing passive movement and you are feeling resistance, I will not repeat 2-3 times few statement because this is recorded. You can rewind and go again. Okay, to understand the deep concept if you are unable to understand. Okay, so waxy flexibility, if I am doing passive movement and I am feeling the resistance just like I am bending the wax candle, and if I leave in abnormal posture, you will maintain the abnormal posture. That is waxy flexibility. Means maintain abnormal posture after passive movement. Exactly same. Yes. But and resistance is present. Resistance present just like bending wax candle. So if patient is acquired spontaneously, that is posturing. If you are doing passive movement, no resistance, then it is catalepsy. If you are doing passive movement and resistance is present, waxy flexibility. Same image, 3 answer may be possible depending on the question. Let me explain with the help of question. A 45-year-old man diagnosed with chronic schizophrenia has no resistance on passive limb movement during neurological examination. Think about the answer. And maintain abnormal posture for long time. No resistance, catalepsy. In the same question, if I change, I remove this no word, now means resistance is present. Now the answer would become waxy flexibility. Okay, so if I remove all this portion, a 45-year-old man diagnosed with chronic schizophrenia maintain abnormal posture for a long time, and then answer would become yes, posturing. What about cataplexy? Yes, plexy is different from lepsy. Plexy is seen in narcolepsy. Narcolepsy. That is sudden loss of muscle tone. Sudden loss of muscle tone. So mnemonic is lepsy is not having lepsy. Lepsy is having plexy. Cataplexy. Got the point? Now, next question. A psychotic patient presenting with voluntary purposeless movement was once seen being mute in the ward. He observed standing in the ward with negativism, waxy flexibility. Yes, waxy flexibility, mute is there. Little bit idea you have. This is catatonia. And medical management of catatonia is injection lorazepam. Other symptoms of catatonia, stereotypy, mannerism. What is stereotypy? Is spontaneous, repetitive, odd, purposeless movement. How you remember, suppose a patient of catatonia is sitting and doing like this. This is repetitive, spontaneous. You are not saying him to do this. Spontaneous, repetitive, purposeless. There is no purpose. Odd. Yes, it will feel odd. This is stereotypy. Mannerism means if a catatonic patient is sitting and everybody who is coming over there, he salutes everybody. Means spontaneous, you are not saying him to do that. Repetitive, he is doing salute again and again. Odd, if everybody will do anybody do salute every time, it will appear odd. Purposeful movement, yes, it has purpose to give the regard. Or semi purposeful, sometimes we use the word semi purposeful. Okay, semi-purposeful means there is no need to give regard to each and everyone. Okay, yes. Anyways, so mannerism, I do remember another example of mannerism. Shikhar Dhawan do like this. Spontaneous, repetitive, odd, yes, and purposeful or semi-purposeful shape is maintained. Now I changed the example. Pushpa, झुकेगा नहीं साला. repetitive, spontaneous, or semi-purposeful or purposeful. Yes, this is the style of bande का style है तो mannerism. But the same pushpa, if do like this, then it would become tick. We will discuss later. So if pushpa do like this is mannerism. If do this, that is Hitchcock movie or Tourette syndrome. Okay, tick disorder. Yes, perseveration, ambitendency, yes, negativism, other symptoms of catatonia. Okay, if you remember the name, yes, questions are asked that these symptoms, just like in this question has been, a negativism is there, vexy flexibility is there. So you must have an idea. These are the symptoms of catatonia, and I told you the symptom treatment also. Okay. Now we come to fourth group of symptom. Till now we have discussed positive symptom, negative symptom, catatonic symptom. Now we discussed disorganization symptom. Disorganization symptom, formal thought disorder. Yes, organization of thought is disturbed. We have discussed disorganized behavior. Sometimes patient would show abnormal behavior. He is picking something from the road. Yes, eating wasting. Okay, inappropriate affect. I have told you. Yes, if go to marriage party, start crying. Inappropriate affect. These are disorganization symptom. So I can say till now I have discussed these are positive symptoms. Yes, negative symptoms. Yes, disorganized or catatonic symptom. Yes, catatonic symptoms, behavior, disorganized speech, formal thought disorder. ICD-11, DSM-5. Now, schizophrenia diagnostic criteria, so many diagnostic criteria are there, just like we have read in the first chapter, Snyderian first rank symptom, thought insertion, thought withdrawal, thought broadcasting, even a single symptom is there, you will make the diagnosis of schizophrenia according to ICD-10. But ICD-11 and DSM-5 said, no, we have different criterias. We will remember DSM-5 first because most of the question you will find DSM-5, but we can't ignore ICD also. ICD-11 we will point out. First of all, if I say to simplify, okay, out of these, yes, two or more than two symptoms for more than 6 months, then the diagnosis is, yes, schizophrenia. If any two, yes, out of these, two or more than two, but to be more precise, yes, particularly for INICET, if you are thinking about that, yes, you will say one symptom should be out of these three. Out of these two symptoms, one symptom should be either delusion, hallucination, or formal thought disorder. Yes, 1 plus 1, but most of time you will find question in which delusion is there, disorganized speech is there. So no need to worry. Two or more than two symptoms for more than 6 months schizophrenia. If these symptoms, two or more than two symptoms for 1 month to 6 months, then diagnosis is schizophreniform disorder. Schizophreniform. Schizophrenia की फॉर्म की तरह का schizophreniform disorder. Okay. Now, one or more than one symptom. Now we say one or more than one symptom for 1 day to 1 month. Yes, mnemonic is 111. One or more than one symptom, for 1 day to 1 month. That is brief psychotic disorder. Brief psychotic disorder. ICD-11 said that we will not make 3 categories, we will make only 2 categories, and according to ICD-11, they said that if 2 or more than 2 symptoms, more than 1 month, 2 or more than 2 symptoms for more than 1 month, diagnosis is schizophrenia. And if these symptoms less than 1 month, then it is ATPD. ATPD, acute transient psychotic disorder. So you can say that in ICD-11, if these symptoms are less than 1 month, diagnosis is ATPD. If these symptoms, now you will consider point, Very important point. If these symptoms are less than 1 month, according to ICD-11 ATPD, according to DSM-5 brief psychotic disorder. Okay, so we started saying that, yeah, why to confuse? Yes, better to say common name of these two: acute psychosis. Acute psychosis. So three name for the same disorder. Yes, many time you will find that a patient is having delusion hallucination for 15 days. Diagnosis is acute psychosis. Diagnosis is acute psychosis. They will not give this or this. Yes, next time they ask question, the patient having delusion, hallucination, formal thought disorder for 20 days. Diagnosis is, they will give brief psychotic disorder in the option. They will not mention ATPD or acute psychosis. Answer would be brief psychotic disorder. Few question you will find that the patient is having these symptoms for 20 days, 15 days, and they will not give brief psychotic disorder or acute psychosis in the option. They will give ATPD. But ATPD you will find, yes, in this there is, yes, stressor is usually there. Yes, predisposing factor is stressor, and fever is important stressor. Question is asked. Okay, and there is polymorphic picture, means symptoms will change from minute to minute, day to day, hour to hour. These symptoms are changing. That is acute transient psychotic disorder. Prognosis is good. Prognosis is good. Prognosis is good. Okay, so the catching point in this would be the duration. If these symptoms are present for more than 6 months, schizophrenia. 1 to 6 month, schizophreniform disorder. 1 day to 1 month, brief psychotic disorder. Clear? Now, this is ICD-11. Okay. Now, prognostic factor for schizophrenia. Yes, onset. If prognosis, यहाँ पे हम good लिख लेते हैं, good. Poor prognosis. If onset is acute, then good prognosis. If onset is insidious, gradually, then it is poor prognosis. Precipitating factor present, good prognosis. Absent, poor prognosis. If positive symptoms are there, good prognosis. Negative symptoms are there, yes, poor prognosis. Family history of mood disorder, फैमिली हिस्ट्री और हिस्ट्री ऑफ, पेशेंट को भी हो सकता है, फैमिली को भी हो सकता है, मूड डिसऑर्डर, देन प्रोग्नोसिस इज गुड. इफ family history of schizophrenia, prognosis is poor. If emotions are present, prognosis is good. If emotions are absent, prognosis is poor. CT MRI normal, prognosis is good. If CT MRI finding, yes, question has been asked, finding in schizophrenia, yes, we found medial temporal atrophy. Medial temporal atrophy. Okay, so CT MRI, if medial temporal atrophy, then it is having poor prognosis. So if schizophrenia findings are there, CT MRI, then poor prognosis. Now you can easily remember good prognosis. Yes, suppose a lady is there, 45-year-old lady, her son died in car accident. After death of son, she started having symptom of delusion hallucination. She started suspecting that my family member wants to kill me. Means now she is having delusion, hallucination is there, and immediately after birth, she developed these symptoms and acute onset was there. Now family physician thought that might be some abnormality in the brain. So CT MRI was normal. She was crying a lot. She was having emotions. She was remembering her son and crying a lot. Emotions were present. And when we took history, we found that she was having family history of depression or mania, bipolar affective disorder. We will say in this patient prognosis is good. In this patient prognosis is good. Yes, acute onset after death of precipitating factor is death. Immediately after symptoms appeared, positive symptoms mean delusion hallucination, good prognosis. Family history of depression was there, mood disorder was there, emotions were present, she was crying a lot, CT MRI normal, good prognosis. So what I took the age 45 years is called late onset, and prognosis is good. Yes, we found if late onset, prognosis is good. Married female, prognosis is good. So you will remember these good prognosis factor also. Okay. Opposite to this is poor prognostic factor. A question was asked. There is a patient sitting in ward and he hears some bad news and start crying. Yes, previously he was taking medication. Yes, now he start crying. Yes, what is the prognosis? Please do think about that. Prognosis is good. If patient is crying, means emotions are present. If emotions are present, prognosis is good. Emotions, this is important. So I will highlight these 2 points on which questions are asked, family history, and whenever questions are asked, you get confused. Most of time you will find family history present or absent, but in this, if family history of mood disorder, good prognosis. If family history of schizophrenia, poor prognosis. Emotions, important point. If a person start crying, don't feel that crying is a bad prognostic factor, it's a good prognostic factor. Okay. Which of the following indicate good prognosis in schizophrenia? Late onset is good prognosis. Family history of depression, good prognosis. Positive symptoms, good prognosis. Developing country, poor prognosis. This is recent update. Previously, we used to say developing country has good prognosis, but recent edition of synopsis, I have taken this from synopsis. Yes, positive and negative prognostic factor of schizophrenia. Positive, acute onset female sex, living in developed country. Developing country, poor prognosis. Developed country, good prognosis. You can understand like this. Okay. Yes, latest edition of synopsis. Next topic is persistent delusional disorder. Only one delusion or related delusion. One or related delusion. Means patient is having only one delusion. Suppose a patient is having suspicious over his wife that my wife is cheating on me. Otherwise, he is absolutely normal. Patient is having delusion, one delusion or related delusion, otherwise he is absolutely normal. He is talking nicely, he go to job, he well dressed, nice, yes, well dressed, polished shoes, talking nicely, everything is fine. But whenever you will touch the domain of delusion, if you will talk about the wife, he would become little bit disturbed or angry. That is delusional disorder, persistent delusional disorder, single or set of related delusion. In this, functioning is not markedly impaired. I just told you he is well-behaved gentleman, talking nicely, polished shoes, going to the job. Yes, but yes, persistent delusional disorder. This is the important point. Duration criteria, ICD-11 says 3 months, these symptoms should be there. DSM-5 says if only 1 month is there, that is sufficient to make the diagnosis. And we will point out here that in these patients, occasional hallucination may be present. Occasional hallucination may be present. Point it out. Not persistent hallucination. Occasional word is important. Occasional word is important. Okay. So I remember this DSM-5 1 month criteria. Yes. Suppose a patient is having delusion of infidelity for 1 month. Yes, we will say this is persistent delusional disorder. Now, a 41-year-old male, in question I have deliberately taken the age of 40, means the PDD is common in middle age. This question has been asked. Middle age, not early age. Not early age. Okay, this question has been asked. Yes. Doubt his wife that she is cheating on him and fights with her without any reason for 1 year. Duration is more than 1 month. Patient reports occasional hallucination. I told you occasional hallucination may be present. Yes. Rest behavior is normal. Yes. Functioning is not markedly impaired. Well-behaved gentleman talking nicely, polished shoes. This can be due to. Answer is yes, persistent delusional disorder. So for 1 year, these symptoms are there. More than 1 month is sufficient to make the diagnosis of persistent delusional disorder. But in this case, patient is having these symptoms for 1 year. And catching point is that hallucination are occasional. Why I'm focusing again and again on this word occasional? Because we have read if the symptoms are more than 6 months, two symptoms are there. If delusion and hallucination are there for more means more than two symptom or two symptoms for more than 6 months, diagnosis is schizophrenia. So in the same question, if I remove the word occasional, if I remove the word occasional, now you will say the patient is, although this language is not so good, but they should improve the language. But even if the same question is asked, you will say that patient is having delusion, patient is also having hallucination, two symptoms more than 6 months, diagnosis would change too. Yes, diagnosis will change too. Yes, point out in your mind. I know this is recorded lecture. So schizophrenia. Okay. So game of single word, you will remember this. Now, treatment of psychotic disorder. These delusion and hallucination are psychotic symptom, and persistent delusional disorder, schizophrenia are psychotic disorder. In psychotic disorder, you will give antipsychotics. Treatment is antipsychotics. Antipsychotics may be first generation antipsychotic, second generation antipsychotic. First generation is also called typical antipsychotic. Second generation is also called atypical antipsychotic. First generation antipsychotic, example haloperidol, we found that they are strong D2 antagonist. Yes, dopamine antagonist. You all are aware that positive symptoms of schizophrenia were due to increased dopamine at mesolimbic pathway. Increased dopamine at mesolimbic pathway. Positive symptoms. If I inhibit D2 receptor, then these symptoms would be relieved. Dopamine antagonist. That is dopamine antagonistic function in typical or first generation. But they will act mainly on or only on positive symptoms. Positive symptoms. Take care of positive symptoms. While, yes, second generation, olanzapine, aripiprazole, risperidone, clozapine, these are second generation. They are D2 antagonist, 5-HT2A antagonist. Yes, means both dopamine, serotonin antagonist. And it take care for both positive and negative symptoms. Improved. So mnemonic, first generation, one type of symptoms are taken care, one types of receptor inhibited. Second generation atypical, two second generation mean two types of receptors are inhibited and two types of symptoms are taken care. A question was asked, the patient is on haloperidol. Patient is on haloperidol. Patient's positive symptoms are improving, but negative symptoms are not improving. What you will do? You will shift the patient from first generation to second generation. As you know, negative symptoms are taken care by, yes, second generation. This was the question. Yes, if a patient of schizophrenia comes to me, I should start with first generation or second generation. Yes, first generation or second generation. Sorry, you can. Yes, first generation or second generation. Yes, guideline says that we should start with second generation. Yes, this is controversial. That's why I am taking the synopsis latest edition. Most guideline recommend starting with second generation antipsychotic. Okay, controversies are there, but I will prefer to start with second generation if question is asked. Now, we found that aripiprazole and olanzapine, questions are asked. Olanzapine, if you take olanzapine, you will become oval. Yes, you will become oval. Yes, or you will become oval just like O. Yes, means weight gain. Means weight gain. Aripiprazole. If you take aripiprazole, you will be as thin as pipe. You will be as thin as pipe. No weight gain. Clozapine also. I have deliberately avoided clozapine here, but yes, I will remove clozapine from this list. Because why, you will understand later in pharma when you will read, then you will find that. Okay. Yes. Yes, clozapine is also second generation. Okay, don't worry. Why I am removing? Yes, but clozapine also cause weight gain, metabolic syndrome. Clozapine also cause weight gain, metabolic syndrome. But clozapine is reserved for treatment resistant schizophrenia. Treatment resistant schizophrenia. Okay. Yes, 45-year-old obese diabetic patient, obese, diabetic, yes, developed auditory hallucination, negative symptom, both positive symptom and negative symptom for past 9 months. He was diagnosed to have schizophrenia. What is the antipsychotic of choice? As you know, the patient is having both positive symptom and negative symptom. So haloperidol is ruled out. Haloperidol is first generation, which take care of only positive symptom. Aripiprazole, yes, can take care of positive negative symptom. Olanzapine can take care. Clozapine, you know, we reserve clozapine for treatment resistant schizophrenia. Why? Because it is very toxic. You will see shortly. Yes, aripiprazole, no weight gain. Olanzapine, weight gain. Yes, metabolic syndrome. So patient is already having diabetes, obese, so you will avoid olanzapine. Okay, and yes, best answer is aripiprazole. Okay, so we will not give this, this aripiprazole. One more important point which can be asked. Yes, suppose you start olanzapine first and patient is getting weight. You will advise patient to do, yes, lifestyle change. And most of time you will find that patient would get benefited by lifestyle change. If patient is not getting benefited, then you may shift the patient to aripiprazole. Yes, this question has been asked. Why we are preferring second generation to start first? Because we found that first generation has more EPS than second generation. So first generation has more EPS, extrapyramidal symptoms, than second generation. So what are the extrapyramidal symptoms? First is acute muscle dystonia. A patient came to you having schizophrenia, delusion, hallucination are there. You started haloperidol, 5 milligram, 10 milligram. Next day, in the evening, after taking first dose, within 2-3 days, yes, patient came to emergency and uprolling of eyeball. That is oculogyric crisis, uprolling of eyeball, oculogyric crisis. Yes, due to contraction of extraocular muscle. They, yes, acute means in a short time. Muscle, extraocular muscle, dystonia, disturbance in tone. Yes, contraction of extraocular muscle, oculogyric crisis. Yes, that is oculogyric crisis, uprolling of eyeball. No need to worry. You will give injection promethazine. Recently asked question in INI. Yes, injection benztropine, injection benztropine, injection promethazine. Yes, drug of choice according to synopsis, it is benztropine. Yes, but question has been asked on promethazine. Yes, you will give injection IM or IV depending on you what you want the result. If you want result early, IV. If you want to get result in few minutes, then you will IM. Another acute muscle dystonia example is torticollis. Suppose he is taking haloperidol in the evening, next day. Yes, patient is having contraction of sternocleidomastoid, twisted of neck, torticollis. Trismus, unable to open the mouth, lockjaw. That is acute muscle dystonia. Okay, it is the earliest EPS. Akathisia. Patient is taking haloperidol, now came after 2 weeks, 3 weeks, means in follow-up patient came. Patient says that Dr. Saab, my symptoms are improving, but Dr. Saab, I am feeling restlessness. I can't sit at one place. Yes, restlessness is there. Subjective restlessness. Subjective. Patient is telling. Immediately attendant told, Doctor Saab, yes, he's not able to sit at one place. He's roaming around in the home, in, out, up, down. Yes, means objective. Patient's family member also reported that. So akathisia is subjective and objective restlessness. Okay. And in this, there is no need to worry, give beta blocker. Beta blocker. Third is drug-induced Parkinsonism, tremors, rigidity, bradykinesia may be there. Next EPS is tardive dyskinesia. Tardive means slow onset, slow onset. Dyskinesia means kinesia means movement, disorder of movement, chorioathetoid movement. You can remember an old person without teeth. You know, the most common age of schizophrenia is adolescent, young adult, around 20 years. Suppose a 20-year-old boy developed schizophrenia. Now he's taking antipsychotic for last 5 years, 10 years. Okay, means it takes years to develop. Now what happened? Now this develop parietal movement like this, and whenever a lady, now he's bank manager. Now whenever a lady comes, he do like this. Daily bitten. Yes. So very disturbing. It is disturbing not because of these bitten things, but because if it is started once, it is really difficult to handle. First management is stop antipsychotic. Okay, and we will give that antipsychotic which is having least EPS. You know, tardive dyskinesia is the extrapyramidal side effect. So least EPS, clozapine. And we will give tetrabenazine, valbenazine. Valbenazine, yes, recently approved drug. So this is about tardive dyskinesia. Now question are asked on clozapine. Clozapine is a wonder drug. It is used in treatment-resistant schizophrenia. What is treatment-resistant schizophrenia? Suppose a patient came to me having schizophrenia. I started antipsychotic. I gave antipsychotic for 4 to 6 weeks, but there was no improvement. Yes, yes. I started haloperidol in adequate dose 4 to 6 weeks, no improvement. I thought that I should use second generation. I started olanzapine in adequate dose for 4 to 6 weeks, no improvement. No improvement. Definition of treatment-resistant schizophrenia is if two antipsychotics, just like haloperidol, olanzapine, preferably from different generation, just like this is first generation, preferably from this is second generation. If given for adequate dose for adequate duration and patient is not getting benefit, then you will say treatment-resistant schizophrenia. In this drug of choice is clozapine. I remember clozapine as close-up. Yes, suppose a person is having schizophrenia, not improving by these medication, he go to the Baba, Nirmal Baba. You know Nirmal Baba? Yes. He ask, beta, have you done brush? Last time brush कब किया था? बाबा रोज करता हूँ. Which toothpaste बेटा? He said, बाबा Colgate. कृपा वहीं अटकी हुई है. Close-up से brush कर. Baba don't know about the close-up and clozapine, the relation we made. Yes, we made a mnemonic, close-up as clozapine, and when he will do brush with clozapine or close-up, he will be treated. Okay, so clozapine is drug of choice for treatment-resistant schizophrenia. And most common side effect of this close-up, sedation. Second most common side effect is increase salivation. Okay. Third is dose-dependent side effect, generalized tonic-clonic seizure. Dose-independent side effect is agranulocytosis. Most dangerous side effect. So how you will remember? Yes, whenever you take this, do brush with close-up, it will cause a good sleep environment and will take a good sleep, sedation. And whenever you do brush, every time there is excessive salivation. Close up. It may be close up Colgate, but here we are concerned with. If you do brush nicely, there would be no granule agranulocytosis. If you are doing brush very rapidly, yes, you have seen in many Hindi movies, it is depicted as scissors. Yes, Hangama movie you remember. Yes, scissors. Aja. है ना. So that is generalized tonic-clonic seizure. It will appear means at high dose, means seizure with clozapine occur at high dose. So you can say dose dependent side effect, generalized tonic-clonic seizure, most dangerous agranulocytosis. Yes, so you can remember by this mnemonic. And if you have seen the advertise of close-up, pass out, there is a girl and a boy, and the boy make this. Other side effect is myocarditis. And when you will get girlfriend or boyfriend, even if you have suicidal ideation, you will not commit suicide. So if you do brush with close up, you will have boyfriend, girlfriend, pass out, and no suicide. So clozapine has anti-suicidal property. One question, yes, agranulocytosis means TLC, DLC will decrease and this may lead to death. That's why we, whenever we use clozapine, we do TLC, DLC, yes, every week. हर हफ्ते पेशेंट को बुलाएंगे फॉर 6 months. दिस क्वेश्चन हैज बीन आस्क्ड 2 times. Yes, TLC DLC every week for 6 months. Although NICE guideline says for 4 months, but synopsis says 6 months. Latest edition of synopsis came again, the mention 6 months, and AIMS when question was asked, they also gave 6 months as the option. 4 months was not given the option, so we will go with 6 months. Okay, so this is about clozapine. This question, a 50-year-old man having psychotic symptom is prescribed drug A. This is recently asked question NEET. Patient did no improve with haloperidol thyroidazine. 2 antipsychotic we tried but no improvement. Patient improved with this drug but developed salivation, increased salivation. Okay, siluria, hyperlipidemia. Yes, I told you that clozapine also cause hyperlipidemia metabolic syndrome, increased blood glucose. Yes, what is the drug? In this question they have given multiple hints, so sometimes long questions are beneficial. If you know that antipsychotic which increase salivation, you will mark the answer clozapine. If you know if 2 antipsychotic fail, you use yes clozapine. Okay, so answer is clozapine.